Welcome, everyone, to the show. We're back with another episode of Health Moments with Dr. Ava. I am the host for season 5 of the Hope TV. For those of you who are new and are just tuning in, I want to briefly introduce myself. My name is Dr. Ava. I'm an internal medicine hospitalist. I have 3 kids, ages 13, 10, and 8. I'm married 10 years to another physician. I'm also an author. I wrote a book called Paging Dr. You. For those interested into going into the medical field, the book is available on Amazon. Check it out for yourself. I'm also the owner of Dr. Eva B Coaching with the goal of coaching future medical students because my passion is increasing diversity in the medical field. The show is about not just having good health, but giving medical info, but it's more of a holistic approach as well that will help you have a good and healthy life altogether. Remember that I will not be giving any specific medical advice, but only general ones. So always seek the advice of your own personal doctor. Today's show is about celebrating the holidays in a pandemic because Thanksgiving is right around the corner. Yes, we are still in a pandemic, people. It is not over yet. There's still a lot of virus in the community. Holidays are so important, they have meaning. People have been isolated and also fearful for almost 2 years. And you're asking yourself, when is it going to end? Well, I have an unfortunate but truthful answer. We don't know. In 2020, the CDC was asking Americans to stay home for the holidays as we awaited the arrival of the COVID vaccine. Also in 2020, experts were urging those celebrating Thanksgiving to wear masks, move events outdoors, and keep it very small. This year, we're highlighting the importance of vaccination for all eligible people. Also, this year, travelers can expect full flights, busy airports, and packed roads. And with that comes the risk of delays and the need for extra COVID precautions, such as booster shots and pre travel testing. Being fully immunized against the virus protects against contracting the virus and significantly lowers the risk of severe illness or even death if you were to catch it. The rules are very different if you're celebrating Thanksgiving with fully vaccinated people. Even children ages 5 to 11 can now have at least one shot and some level of protection. Kids that are less than 4 are not eligible for shots, but they're still, somewhat protected if they are surrounded by people that are vaccinated. Those who are older or immunocompromised may not have the same immune response to the vaccine, leaving them very vulnerable to contracting the virus, even if they're fully vaccinated. So if you're currently eligible for a booster shot, now is a great time to get that extra dose. I want to introduce my next guest, Dr. Alexis Drayton. She is also a colleague of mine, and she is all around amazing. Dr. Alexis Drayton is an internal medicine physician who graduated from the Medical University of South Carolina. She is currently a hospitalist at Piedmont Healthcare in the Atlanta area. She's been taking care of COVID patients since the very beginning of the pandemic and has special interest in preventative medicine and also hospice care. Welcome to the show, Dr. Drayton. How are
Hello,
you?
Dr. Ava. Hi.
Thank you for coming on today. I know you
Of
had a very, very
course.
good day. We work together for those of you who don't know. I'm also a hospitalist, so is Dr. Drayton. So tell everybody what a hospitalist is, because I know a lot of our viewers probably have never heard that term before.
So I like to think of a hospitalist. Actually have a really cool shirt that gives the definition of a hospitalist that says a doctor that diagnosed things you didn't know you had in ways you don't understand. But basically, a hospitalist doctor is just someone who, for the most part, is internal medicine trained, can also be trained in family medicine. And when you go through your training, you can kind of decide whether you want to do an inpatient route or whether you want to do an outpatient route. Hospitalist physicians are internal medicine or family medicine practitioners who only treat patients in the hospital. So they only deal with acute illnesses instead of management of chronic illnesses.
Right. And most of the time, they don't really continue to follow the patients. We just do what we need to do in the hospital and then leave it up to somebody else outside to continue to monitor and follow them. So that's very important for people to know. So, how long have you been a hospitalist?
I'm dating myself here. Since 2013.
So is
Since
that when
2013.
since you finished residency?
Since I finished
2013.
residency, I went straight into hospital medicine. I have no interest in outpatient medicine at all.
I would probably count the residency years as part of those years. So, you
So
know,
now it's 10. Now even more years. Now 11 years is where you're
yeah,
getting.
technically when you're in residency, you're a doctor. You're already in the hospital setting. You're doing everything on your
You
own.
are.
People ask me how long I've been a doctor for. I always count the beginning of my residency as well. So give yourself that extra 3 years, girl.
Ugh. All right. Yes, I've been a doctor since 2010. I've
Maybe
been a hospitalist.
old, right?
Exactly.
Right, right. So let's talk about COVID. So
Let.
yeah, I know, I know. So I know a lot of people still have questions about the vaccine. Can you kind of tell them a little bit what the vaccine is, the mRNA, what does that mean? Um, Everything about the vaccine in general, because people still have a lot of questions about that.
I think without getting too technical or scientific, the important thing to understand about the vaccine is that um, it's a short-term exposure. So just like you would be exposed to COVID or the common cold or any other illness, um, it's a short-term exposure. The way the vaccine is set up is not a live vaccine, meaning that they take a piece of the vaccine that actually can cause an infection to try to, produce an immune response. They're taking a part of the actual virus that's just a piece of the protein, but that cannot infect you. And again, without getting too scientific, when your body has cells, and these cells have receptors, and this is how your cells can recognize what's part of your body versus what's not a part of your body. When your body recognizes something that's not innate to you, that's not a part of your body, it starts building a response. These vaccines show your body something that's going to trigger a response, but what it's showing your body cannot actually do anything to harm you. It's just a way for your body to recognize something that's abnormal and produce an immune response so that when you actually get exposed to the actual virus that can actually cause disease, you already have your army built and you can already be ready to fight. And that's the whole point of the vaccine. I like to tell people who do have questions or are concerned about the vaccine, if you're on prescription medication every day, you're consistently exposing yourself to an artificial, man-made, science-built drug that you take every day to control your problems. The vaccine in itself is a one-time exposure and it is not in your body anymore. So, sometimes people are concerned about it being not natural, but it is natural. It's your body's immune response, not coming from a lab.
Right. So I like how you explained that, like, your body is already armed so that when the virus comes, your own body, your own cells are ready to fight. You may have symptoms, you may be asymptomatic, but if you do catch it, your risk of dying are way lowered because you already have that army built inside of you that can fight this foreign thing that's coming. So that's the thing. Because a lot of people say, well, what's the point of the vaccine if you can still catch the COVID? They don't understand that the vaccine doesn't prevent you from catching it. It minimizes your risk of catching it. But if you do catch it, at
Mhm.
least you're able to fight it and your chances of surviving are very high compared to somebody who doesn't have the vaccine. So,
Absolutely.
yeah, that makes a
it's it's
huge difference.
it's it makes a huge difference. And another thing that I like to tell people when they say, well, what's the point of getting it if you can catch it, if you can still get the virus. It's not just about not getting the virus. Like you said, you can still get it. But we're trying to reduce the severity of illness. The ultimate goal, people need to understand, we're not going to eradicate this anytime soon. This is here. But what we want to do is turn it into something like the common cold, the sniffles. We want to make it so that when people do get infected by it, it doesn't ruin their entire lives. It doesn't destroy families, and it doesn't take lives.
Agree, agree. Plus, it doesn't overburden the healthcare system because over the
Mm.
last couple of years, we have seen so much that the public has not seen. And that's the scary part because we saw it all, young, old, dying, surviving, in between. And the crazy thing about it is our hands have been tied. We're used to saving lives, helping people, figuring out what's going on, coming up with a diagnosis, coming up with a treatment, and then they walk out of the hospital okay. But this time, we really didn't have anything. And what we had was just to try to help a patient, not even knowing if it was going to work. And quite frankly, most of the things we were trying probably didn't work.
And
It was just
it's important to note that we're still doing the same exact thing, trying things that don't work.
right, right. It's a challenge. And ultimately, we are helping you help your body fight it on its own. Your body has to fight this thing. We don't have no cure. We don't have no medicine that takes away the COVID. Well, now, there's this new pill that came out, but still, I mean, we haven't tried it yet. We don't know.
Yeah, we'll see.
So we'll see. Right. We'll see.
We'll see.
Yeah. So
We'll give it the old college try.
yeah, that's all we can do, and we're getting ready for a potential other peak. I'm hoping that's not going to be the case, but with the holiday coming and people are just quite frankly tired of all the different things that are coming out, social media, the truth, not the truth, the lies, the theories that are out there. People are just tired of like wearing masks, so they're letting their guards down sometimes a little too soon. And that's a recipe for a potential disaster and a potential surge. Everybody's getting ready to travel, everybody's getting ready to get together. Thanksgiving, Christmas, New Year's. So, um, people, the pandemic
Well,
is here. The virus is still here. It's not
but there are
gone yet.
ways to protect yourself. There are ways to
And that's
protect
what
yourself and your
we talk
family.
about. And that's what we need to talk about. So everybody that's coming to the party, any party, Thanksgiving, let's talk about that. Anybody that's coming to the party is bringing their behavior from the last week into the party space, whether they're vaccinated or not vaccinated. Is it safe to celebrate in person with family and friends this holiday season? What's your take on that?
So, a lot of recommendations as physicians, our recommendations and things that we follow regarding the CDC didn't start with COVID. People are just now hearing about recommendations from the CDC and other organizations that direct care and how to take care of people. So you do have to rely on these larger organizations that make these recommendations because they're the ones with the power to do the research and the resources. So when you ask the question, is it safe? It's a loaded question because it depends. Is this a small gathering? Is this a large gathering? Are the people coming vaccinated or unvaccinated? Are these people with immunocompromised systems or are they young, healthy individuals? So when we talk about safe, I think we have to focus on what are safer practices and not necessarily what is safe. Because we just had a discussion, no one's safe, vaccinated or not. We all can have exposure. So when you're talking about safety, in this case, when it comes to holiday gathering, there are not safety in numbers, okay? So you want to, if possible, have small gatherings. Referring to people that you have actually been around during the pandemic, people that might not be directly a part of your household, but you're familiar with their behavior, you're comfortable with them, you know that they are also taking the same precautions that you are. Having small gatherings with that group of people is considered safer. When we talk about other safer practices, when you're having these family gatherings, it's nothing wrong with asking family members if they're vaccinated versus not vaccinated. Also asking family members that might be coming to your home if they will be getting a COVID test before they come through. These are all things that you can try to do to make your holidays safer. Also, if you do have people that are coming that are unvaccinated or vaccinated but older with immunocompromised systems, mask wearing is still a thing. Also taking these celebrations outside, eating outside or in your garage, anything that you can do to make things safer. The larger the gatherings, obviously, the more exposure you're likely to have. But if you keep your gatherings small amongst people that are vaccinated, that's your safest way to celebrate. And if you do have to incorporate anyone in your family that is unvaccinated or immunocompromised, then mask wearing, hand washing, all of those things still are in play.
Agree. So, again, summarizing everything that you just said, everybody's community has a different amount of virus. Some communities, some places have way higher virus than others. Some places have less vaccination status than others. So knowing the people that you inviting, knowing their behaviors, who they're hanging out with, can you trust what they're telling you they've been doing? If you have grandma and grandpa at home, you want to be careful who you're bringing into the household. A lot of the recommendations and guidelines from last year are still the same. Like you said, it's not new. Wash your hands frequently. Use hand sanitizers when you cannot wash your hands frequently. Still wear a mask because, that's important. You still want to social distance when you can. If you're outdoor, cool. You don't have to wear a mask, but you still want to stay away from people a little bit, only because outside the air circulates a little bit more, and so less virus in the air. Things like that are super, super, super important. Because a lot of these recommendations are still the same. Nothing is new when it comes to that, with some minor changes. Okay, let's talk a little bit about the booster. Do you think there's an optimal time frame to get a vaccine booster before holiday travel?
Well, I think the current recommendation, again, going back, is around 8 months. From anecdotal experience, meaning that just things that we have seen, not large studies, people that have been vaccinated, immunity starts to wane a little bit before 8 months. I'm seeing people coming into the hospital fully vaccinated, but contracting the virus maybe at like 6 months after, 7 months after the vaccine. The time to get the booster is when you're eligible. That's the time. So, you're not going to be able to get the booster prior to a certain time frame. So if your holiday is coming up and you're 4 or 5 months out from your vaccine, you're still deemed in the safer zone to where you have immunity, you have some protection. Obviously, when you're getting the booster, the plan is you still have to wait. You still have to wait for an immune response. You still have to wait for your body to respond. So at this time, before Thanksgiving, getting a booster today isn't really going to increase your immune system right now, but you'll be ready by Christmas. So as soon as you're eligible for your booster, holidays or not, it's time to get it so that you keep that level of protection to save your life.
Right. So you want to at least 2 weeks after the booster. Since, if Thanksgiving is happening before 2 weeks, it's probably not going to help you for Thanksgiving, but it may help you for the next holiday. But it'll take about 2 weeks for that vaccine to actually go into effect and make a difference in your body. So that's important for people to understand. You don't take the booster today and you're good today. It doesn't work that way.
Yeah. Your body still has to have a chance to respond to it.
Right. A lot of people are saying, well, again, what's the point of the booster? If I can still catch it. It's the same thing as them saying, what's the point of the vaccine if you can still catch it? Most of the people that we see in the hospital that have contracted the virus after receiving the booster or being fully vaccinated make it out of the hospital alive. And that number is pretty high. It's like upper 90s, right? That's been your experience too, right?
Yeah, so I haven't had any experiences with yet because the boosters are fairly new. So I haven't had anyone coming in with the virus after they have received a booster. I do have my patients coming in who are fully vaccinated, both doses, but their last dose was in June, or they were fully vaccinated in July. And so now they're having the immunity kind of wane off a little bit. And that's probably why they're coming into the hospital. But again, these people make it home alive. It is more likely that, and you mentioned this earlier, your older population, people with a lot of other medical problems, they don't have the robust immune response that you would hope them to have, even with the booster, even with being fully vaccinated. but anything that you can do to help reduce your risk of severity of illness leading up to death is important. Why do people do anything why do you still eat if you're going to get hungry again? Why eat if you're just going to get hungry again? I mean, what kind of question is this? I don't want to be hungry. Like, that's why I eat.
Yeah, and people may ask, like, why is it that older people may not mount a response? It's because in order to mount a response from the vaccine, your immune system needs to be very strong to be able to take in what the vaccine is giving it and building that immune system for you. And older people, the older you get, the more your immune system goes down as age goes up. That's just something that happens. The older you get, the more vulnerable you are. And there are a lot of young people that also have immune issues, people on chemotherapy, people on chronic steroid therapy. Anything that reduces your immune system will not give you the same immunity to the vaccine. So just keep that in mind. If your immune system is low and you get the vaccine, you're not going to be protected as much as somebody else who has a normal immune system. So you are more likely to catch the virus if your immune system is low.
So therefore, you need all the protection you can get.
Oh yeah, absolutely. Stay away from people, social distance, wear a mask, wash your hands, go outdoor. The same things that we've been talking over and over and over since last year and the year before. Is it possible to travel a little more safely via train or plane right now?
So the recommendations when you're traveling on a plane or a train, again, haven't changed. I applaud the airlines for still requiring masks. The government is still requiring masks, and the airports were still requiring masks. I think the travel, as far as the plane or the train, those are still in place. The recommendations are still in place. But I think what we have to take into consideration is when you get off the plane, when you're coming back home after you've had your holiday. For a vaccinated person that's visiting an area that's considered high or substantial COVID numbers, you're still recommended to wear masks just because of the amount of viral load that's in the area that you're in. But if we want to focus a little bit on the people that are not vaccinated, a lot of COVID and the things that we've been trying to preach are really part of community. And I say that to say it's not just about the individual, it's about us as a community. So when you come back from your travels and say you're unvaccinated, you have a couple of options. You should get tested 3 to 5 days after you've come home to make sure that you don't have any virus. You can self-quarantine for 7 days. This is all just kind of personal responsibility when we're thinking about the community. And obviously, if you test positive, then you would go under your 10-day quarantine. So, there's things that you can do to be responsible after your trip, after your holiday is done and you're coming home. How do I go forward? If you get tested and you're negative and you don't have any symptoms, great. You've done your part. You've participated in the community, trying to keep yourself and everyone else safe. And if you're vaccinated and you come back, it's more so, I think the recommendation is just for you to monitor for symptoms to make sure you're not having any COVID-like symptoms once you come back from vacation. So whether it's plane, train, whatever the case, when you're done with your holiday, come home, protect yourself, protect others, and that's how we get through this.
Right. And even if you're driving your own car, good. You're not around people, you're in your own car. But when get to your destination, are you gonna be around people? What are you going to do when you're at that destination? So again, it doesn't matter if it's plane, if it's train, if it's your own car. However you get there, just make sure that when you get there, you study what the COVID conditions are in that community, who you're gonna be around, what their behaviors have been, their vaccination status, your vaccination status, and then making a safe decision based on all of these factors. It's not just one thing, it's a multitude of things. That's what makes it important. Some people say, well, what happened to flu? Where did flu go? Still get the flu vaccine. So
I can tell you what happened to the flu.
Go ahead and tell everybody what happened to the flu, because now they're saying, oh, all of a sudden everybody's talking about COVID And where's the flu now all of a sudden? Because every year we hear about the flu, and now we don't hear nothing about the flu. Flu is still out there, people, but go ahead and tell them.
The flu is on the mask that you've been wearing. That's where the flu is. So the reason that we don't have a very robust flu season right now is because of all the mask wearing. So prior to, we have the flu vaccine, and obviously even before COVID, people were iffy about the flu vaccine and, well, I don't get the flu shot because I don't get the flu and things like that. The difference between the flu and COVID is that the flu kills a very specific subset of people. It's killing older people, again, immunocompromised, and those are the people that you really want to push for the flu vaccine. Healthcare workers, people high exposure, flu vaccine. When people young out in the community get the flu, they stay home a couple of days and that's that. When we're dealing with COVID, it's a lot more virulent, more likely to kill you, and it doesn't have a particular subset of people. Anybody can catch it, okay? So when we're talking about where's the flu, it's the mask wearing. That's the reason we don't have a very strong flu system. The flu still exists, but it's very difficult to catch the flu when you're wearing masks. So the same thing applies even before COVID. Washing your hands, sanitizing surfaces, keeping things clean, using your arm to sneeze and cough, not using your hands, and wearing your mask. That's where the flu is. The flu is out there, but it just can't infect someone when you have a physical barrier.
Agree.
And hygiene.
Right. And that to say, if you don't feel good, don't assume it's allergies. Don't assume that, oh, it's just the sniffles. Stay home. Don't be going to nobody's Thanksgiving party knowing that you don't feel good, especially if you have not taken a COVID test to differentiate whether or not you have the flu, whether or not you have COVID, or whether or not you just have allergies or whatever it is. So stay home.
We've had several people come into the hospital and say they didn't feel good, but they went to the gathering anyway. Or a family member that came into the hospital and found out that someone that was at the gathering didn't feel well, but they thought it was just a cold or they thought it was just an allergy. It's COVID, people, until proven otherwise.
Especially now. Okay. So you start wondering, do people really know what the symptoms of COVID are? Because when they do tell us things like that, I'm like scratching my head like, okay, you weren't feeling good. You had all the signs and symptoms, but you thought it was something else. Well, let's tell them what the signs and the symptoms of COVID are, which are very, very similar to the flu and very, very similar to allergies. A lot of it are the same. So it's really hard to tell. You can't diagnose yourself. That's why we say stay home. And that's why we say get your flu shot, get your COVID shot, because those can minimize your symptoms so that you don't come to the hospital. Because when you come to the hospital with those symptoms, we also don't know if you got COVID, if you got the flu, what you got. So you're overwhelming the healthcare system. You're making us use a lot of the PPEs. You're making us use a lot more tests and things like that we could save for need. So tell everybody what the signs and symptoms of COVID-19 are, just so they know, because we're about to approach Thanksgiving.
Okay, so, well, for one, let's start with number one, no symptoms at all. So I think that's one of the scary things, is that we have people who are carrying the virus, are actually able to pass the virus, but they themselves have no symptoms. That is 100% possible, which is the importance of getting a COVID test before you go to your family gathering. Is just the responsible thing to do, because you could be what's called an asymptomatic carrier. Now, when we talk about symptoms, we can talk about your common cold-like symptoms or your flu symptoms. Fatigue is a very significant complaint that people have when it comes. And this is before we even get to people that are hospitalized. We get fatigue, we get shortness of breath, we get coughing, fever. But fever, we have all these restaurants and people wanting to do temperature checks. That means nothing. Fever means that you have pretty bad COVID. It's a poor prognostic factor in COVID, but it's not something that if you don't have a fever, you don't have COVID. So fever is an important part, but having a normal temperature does not mean you don't have COVID. People also get nausea, vomiting, abdominal pain. diarrhea. So all these acute viral illnesses, even if you think you have the allergies, if you're coughing, if you have a runny nose, if you have post-nasal drip, one of the things that we have found that definitely is not a symptom of COVID is sneezing. That has not really been one. But then those symptoms can progress. So you might think you're starting off with allergies, but especially if your symptoms progress, if you start getting more short of breath, if you start having difficulty going upstairs that you didn't have before, then people can start developing chest pain. Another thing we have to consider with COVID are the complications that come with COVID. We've had in the hospital several of our beloved colleagues die from complications of COVID. You might not feel bad enough to go to the hospital, but you've developed leg pain, you've developed chest pain. Those are things that could potentially be blood clots that are very serious complications. So you cannot self-diagnose. If you are sick and you don't feel well and you're having any respiratory symptom, any GI symptom, extreme fatigue, dizziness, vertigo, those are things everybody presents a little bit differently. You need to be evaluated.
Agree. And now they do sell tests over the counter, so no excuses. You can go and buy something from CVS, from Walgreens before going to a gathering, just so that you are a responsible citizen, a responsible person. You don't want to be the cause of somebody else's death or somebody else's severe illness because you knew you had it and didn't say anything because you did not want to miss out on the fun, or you thought maybe it wasn't COVID. Let's all be responsible. If we all do our part, we can really help, at least, I'm not going to say eliminate this, but at least keep it at bay so that we can control this thing a little bit. I think from this point forward, we're going to have to just learn to live with it. I don't think COVID is going to go anywhere anytime soon, but I think if everybody does their part, everybody gets vaccinated, everybody gets their boosters when it's time, we all still wearing masks, wash hands, we can kind of minimize the COVID so that we don't have those crazy amount of spikes that's happening. Because when you see spikes, it's because there's been behaviors that people
High
were
risk.
not. Yeah, perfect word.
High risk behavior.
High risk times, the holidays, is a very important season. So we're getting ready to probably see a spike in January or February, right after the new year, because we're about to have 2 or 3 holidays back to back.
Right. And
before
I
I
think
let
the
you,
concern is more so it's definitely a and because these holidays are falling toward the end of the year and our susceptible population were vaccinated early in the year, you would think that more people are vaccinated so the surge wouldn't be as bad. But I'm concerned that if people don't go and get their boosters, we're going to end up back at square one because the immunity is going to wane and they're not going to be as protected as they think they are. And we're going to have that same surge all over again. So I predict that this is going to be like the flu shot, just an annual. Every year we're going to have to get boosters. We're going to have to do this. So now's the time. Yeah, you got to get these boosters. Otherwise, we'll be looking at another February surge, March surge, and more deaths and more families ripped apart.
I agree. I think it's a new virus that's here to stay, just like the flu. And there might be new strains every year, just like the flu. We don't know, but I don't think it's going away anytime soon. So let's find a way to live with it and live with it safely. Before I let you go, we're not going to be able to tell people not to host a gathering. We're not going to be able to tell people not to go nowhere. That's impossible. Okay. Thanksgiving is coming. Christmas is coming up. What we need to tell people is how to safely do it. So if you are hosting a holiday gathering, are there any rules that they should put in place for their family and friends that are coming over?
I can tell you what I would do. Okay. And we touched on this earlier when we're talking about gatherings. If you are hosting people that are not part of your circle, not part of your household, not part of the people that you've been with whose behaviors there's nothing wrong with asking for them to get COVID tests. If you're the one hosting, ask your family to get tested for COVID before they come to your home.
And then test 2 to 3 days before coming. So that's one. What's the second thing you would do?
I would definitely still, I would try to hold as much of my gathering outside, inside, outside, open windows, open doors. Yes, it's a little chilly around the holidays, but I think you can deal with it if you're just trying to get circulation in your home. You want as much ventilation as possible. So the more you can do outside, the more gathering you can do outside, the better.
Okay, so number
So
two,
that would.
is good. Place table outside. If it's not too cold, maybe buy
Mhm,
heaters and do everything outside.
mhm.
If it's not possible to be outside, be indoor, but try to spread the tables apart if you can. And every once in a while, open up a window, let the air circulate. Open up a door, let the air circulate. Close it back, let the heat come back. You
Mhm.
know, that can actually help move air and help minimize the amount of virus that
Mhm.
you may have in your home. What's the third thing you would do?
Right. Definitely, everybody needs to wash their hands soon as. And this is a hard, fast rule in my home. Period. You walk in this door, you take off your shoes. Now, shoes don't have anything to do with COVID, but you take off your shoes, and then you go to the bathroom and you wash your hands. So
There
before
you
you
go.
come in my home and touch anything, straight to the bathroom, wash your hands. I don't know where your hands been. So
Okay.
definitely,
Make sure
definitely,
everybody washes their hands properly. And we have to tell people
yes.
when you wash your hands, it needs to be with soap and water, not just water. You got to really put soap everywhere for 20 seconds straight in between your nails, 20 seconds straight. The whole happy birthday song, and then rinse it out. So it's not just a little trickle of water, a little bit of soap. You really gotta scrub your hands, scrub in between your nails, on top, all of that. And then maybe in the bathroom, don't put towels that people can share. Maybe you can have like paper
Paper
towels
towels.
that you use and throw away. Okay. And there's another thing
Yeah.
for you think you can say for
Um,
what?
I mean, I think especially if you're having people that are coming to your home that are unvaccinated or immunocompromised, they still need to be wearing masks when they're indoors. They're around a lot of people. I know we're talking about Christmas dinner and Thanksgiving dinner, and just like on a plane, if you're on Delta, you know what Delta tells you: take your mask off, take a bite, put your mask back on, and chew.
Yeah.
And I mean, I know it's a bit excessive, right? To eat, it's a bit excessive. But when we're talking about recommendations for safer practices, when you are inside and you have a family member here and you have a family member there and you're not as spread out, when you're inside talking, wear a mask if you're unvaccinated or you're immunocompromised. These are the things that you can do to keep yourself safe and also keep the people that you're in the house with safe as well.
Okay. And then maybe number 5, tell everybody you don't feel good, stay home. Don't leave
Stay home.
here.
Stay home. Stay
Home. I
home.
will save you a plate and maybe I'll
Right.
drop it
We'll
off
bring
to
you a
you.
plate.
Yes, don't come
We'll
if you
FaceTime you.
feel
We'll
good.
FaceTime.
Right.
FaceTime. I just FaceTime. Hey family, I don't feel good. I don't know my COVID status or I'm COVID positive. I didn't want to come and hurt anybody in my family because you're going to claim that you miss your family, you care about them, you want to see them, but then you're the same person that's going to show up and hurt them. And that's what we
Yeah,
don't want.
that's not right. That's selfish. Well, thank you. That was 5 great tips that you gave. And I think this was a great conversation. I want to thank you so much for coming on here. I know you're super busy. You had a long day at work. But this to me and our viewers because I think we need to be the ones to educate the population, especially the people that look like us, because they don't trust, but because we are actually, taking care of those patients. We want to make sure they get the right information from the right people and not from the internet. That way they can make an educated decision. Thank you so much for
Correct.
coming on.
Anytime.
Have a great day. So many of us are now in the recovery phase of this pandemic. During the early crisis, we needed to stay home to stay safe. Even though the pandemic is still out here, now we have vaccines, and it's time to think also holistically, focusing on your mental health, your emotional, and your social aspects of our health too, because we're forgetting the emotional, social aspect and the mental health. All of that is part of a holistic approach. Of course, a holistic approach works only if you've been vaccinated and continue to take a few reasonable precautions. For the unvaccinated adults, the pandemic will remain a daily threat. and a personal choice to stay unvaccinated will continue to put you and those around you at risk. The choice to be vaccinated absolutely impacts your individual holiday experience. I always say that. If you're not vaccinated, or if you're having a large event with people of mixed vaccination status, there are a few different things you can do to keep Thanksgiving dinner safer, because there's no such thing as safe. Many of the precautions are not new. As always, distance, ventilation can help prevent COVID-19 from spreading. Wearing masks when indoors can prevent the spread of the virus. Keeping gatherings small or limited just to members of your household can also help. You can also get tested before gathering. Rapid test results will return in just a few minutes, while PCR tests can usually be a little bit more accurate. In some areas, at home rapid tests are even an option, making it easy for people to make sure they are not asymptomatic, or that they are not symptomatic, or that they're not asymptomatic carriers of the virus. I don't know if that makes sense. If you take a home test, you're able to tell if you are carrying the virus and don't have any symptoms. That way, you don't want to go somewhere, be COVID positive, and not know it. So it's just safe practice for you to just know your status. Avoid crowded and poorly ventilated spaces when possible. Of course, make sure you avoid attending any group gatherings if you are showing symptoms of COVID-19 or any other illnesses. If you're traveling to a family gathering, make sure that you take appropriate precautions on the way there. You still want to make sure that you wear a mask, and that whatever mask you wear fits very well and covers your mouth and your nose, because I see a lot of people wearing masks and it's under their nose. That's not protecting you. It has to be fitted and it has to cover your mouth and your nose. Keep distance from other passengers. Maintain proper hand hygiene. Do not put masks on children that are younger than 2 years old. I forgot to mention that above. And always follow the CDC domestic or international travel recommendations, whether you are vaccinated or not. By working together, we can enjoy safer holidays, safer travel, and we can protect our own health as well as the health of our family and friends. I hope this was helpful. As always, I'm rooting for you. See you on the next episode of Health Moments with Dr. Ava.